Oh my god, it's not in the short, it's in the hair. Hi everyone, welcome and welcome back to my channel. This is Roop and you're watching In Style with Roop. I'm sure you had a good laugh seeing me struggling with those hair flips in the beginning of this video. But many like me would be suffering with hair thinning and hair fall and would be dreaming to have lustrous and voluminous hair. Even I found a couple of products that helped me stop that hair fall, but owing to the chemical treatments we make our hair go through, having those good tuft of hair back on your head is certainly not an easy job. So in order to get answers to all the questions that I have in mind to get a fuller, voluminous hair back on my head, I thought let me go and meet my dermatologist. So let's get going. So I'm finally here at my dermatologist, the most gorgeous ever. Hi Dr. Manju.
Hi, Roop, please come. How are you doing?
I'm good.
How's the skin doing?
Skin is doing great, all thanks to you.
That's great to know.
Like I discussed with you over the phone, this time it's not my skin. I have some things, some questions related to my hair.
Sure.
Like a couple of times I discussed earlier also with you, I had hair fall, though my hair fall has stopped to quite an extent. But I want more fuller hair. So how can we help it out?
Okay. So, firstly, we need to realize that hair is something that grows slowly. Because if I give you any medicines or any treatment, to get volume over here, it's very difficult to get it instantly. Okay? So, we have to start slow. You have to always give hair at least 3 months for it to show some results. Whenever we start some treatment, always shows more over here first and then slowly progresses down. There are few quick fixes like volumizing shampoos that might help you initially till you get the density back.
Okay.
But when you're on treatment, you need to remember you'll have to stop your coloring, your hair, chemical straightening, hot irons, and you'll have to use a lot of heat protectant sprays so that the hair starts becoming healthier. The problem with getting the whole hair thinner is when your hair cuticle is damaged. Your hair cuticle should not be damaged, and that's when it looks shiny.
That's what is the problem with my hair, I guess, because of so much of experimenting that I've done with my hair, lots of color treatments, then always I'm there with my iron coloring or the tongs, So I think that's what that has damaged my hair. So there are treatments like mesotherapy, there are treatments like PRP that help. Can you tell us and my viewers who are watching this video about that?
Sure. Yes. So when we talk about PRP or mesotherapy, they're both treatments that help stimulating your hair roots. Okay? Now PRP is done when we collect your own blood and then we process it, remove the platelet-rich plasma, which helps in stimulating your hair cells to give much more growth. Okay? So people who are having hair fall and who are having need new hair growth, I give them PRP along with medicinal therapy. PRP does not work alone. That is one thing. When we talk of mesotherapy, it does work alone. Even if you're not taking any medicine, it works. But mesotherapy will first help in thickening your hair. That is the first thing. So if you just want thickness, mesotherapy. If you want to solve hair fall and all, then I think PRP works better because mesotherapy doesn't work that fast on hair fall. It takes some sittings to get achievement for hair fall, So there's a two difference between the two things, and mesotherapy is a premix. It is not something that I make from your blood and all. It's a premix. I use solutions from Europe and they have different vitamins in it, different chemical constituents in it, which help your hair in getting, it's like a bodybuilding device. Somebody who's just having a lot of protein, it doesn't build up. So that's how your hair gets very built up. That's how it works.
Right. And what about the oral supplements? I've heard biotin helps to stop the hair fall and even stimulate the new growth.
So with biotin, I'm not a big fan of biotin because biotin बहुत use हुआ है. Most of the patients who come, they've already eaten biotin and they've come, So more than biotin, I think it is iron and your regular vitamins, which have a very big role, because as an Indian lady, in India, women are so deprived of nutrients, and it's very important that they get their hemoglobin, their vitamin D, vitamin B12 checked, which is very essential for hair.
Absolutely. I've even heard about minoxidil.
Minoxidil,
yes.
Right. So minoxidil is the only US FDA approved topical solution that works for hair fall. Okay, and it is one of the best treatments. But you have to remember, it is temporary, which is like all the hair treatments. As time passes, you have to get sittings, and also minoxidil is also something that you have to use over a very long period of time. It works for men and women. That's the good part of it.
Like you said, you added that it is not a permanent thing. Even I have read, the hair that you get after using minoxidil, it falls again.
So it's like if minoxidil gives you 100 new hair and then you stop it after 2 years. So only 60 would fall off, only 40 would stay.
2 years, you have to continue the prescription for 2 years?
You have to continue it lifelong.
Oh my god. Now, one more thing I would like to ask for all my male viewers. So, those male who suffer from that balding patterns, does this mesotherapy and PRP or minoxidil help in that also?
Yes, all transplant patients have to use minoxidil even after the transplant.
Okay.
Because it's going to help. It's maintaining that growth. Plus your existing hair, which are there, it will start stimulating them. So it definitely has multi.
And what about these treatments like mesotherapy and PRP?
I feel that in using mesotherapy and PRP along with the transplant, PRP works better. Not meso.
Okay.
So there are some combinations that we work on, but PRP works better.
Now I know a lot about mesotherapy and PRP, but still again I'm stuck with the same question. Like, what do you suggest for me?
I think you should start with mesotherapy for you, and also you should have some oral supplements to supplement your diet, which would definitely help the hair in getting much more luscious and much more shine and getting the density back in mesotherapy.
Wow, great. And how many sessions do you think I'll require for this?
So mesotherapy, ideally we need 5 sittings, and there are a gap of 2 weeks.
Okay.
That is done. It can be done with the derma pen, which is a device, so it helps further increasing the blood supply of the scalp, which helps the hair fall again.
Is it painful?
We do apply a numbing cream, you'll see now. So with the numbing cream, it doesn't pain.
Right. So well, I think that answers all my question, and I think that is all what viewers would have wanted to know.
Sure.
And one more
Glad
thing. Yes, I think it's going to be a great help for them to decide what kind of therapies would actually work, rather than rushing to the salon for their treatments that actually do not bear any results.
True, very true.
Yeah. So let's get started.
Done.
Okay. So now we're cleaning the numbing cream that was applied already.
Yes, we're cleaning it with spirit and sterilizing the entire area right now. And I'm just also going to tell you about what we're going to do now.
Yeah, great.
So this is a cartridge. Okay, can you see? Then this is a cartridge, which is going to go on the derma pen. It's a sterile cartridge.
Right.
And this is a 42 pin cartridge.
Right.
Okay, so that means but there are 42 tiny pins on it. There.
Scary.
Now, actually, if you think about it, 42 pins is less scary than 1 pin. Think about it. If you're walking on one nail, it always pains more. But if you're walking on a bed of nails, it does not pain.
I get that.
So when you have 42 nails, you will see yourself, you'll have no pain. So this is one of the most
I hope so, with the numbing cream on.
Yes, don't worry. You don't worry. So these 42 pins are going to go in like maybe just 0.5 into your scalp, not more than that.
Right.
So it'll be very
You by my side and you doing it, I'm totally fearless.
Don't worry, you'll be very comfortable. So this is my derma pen and this is my cartridge that I just opened. So we use 1 cartridge per person. So Rup, this is your hair loss solution that we're going to use. This is your Meso solution. It comes from Europe, from Spain. And so what are the contents here? There's one thing which is a copper peptide. Peptides are known to give very good hair growth. There's also a capsicum extract in this called capsaicin. Okay? So that is the thing that is giving you a little burning sensation when I do the procedure, maybe after that for maybe half an hour. You'll feel a little tingling there. That is the ingredient that pulls all your blood supply there. So whatever nutrients are going, your blood supply will be taking it along because of that capsaicin that is there. Okay? So it's a very scientific solution. It's not like, you know, a quack thing. It's very good solution, and I have seen results even with one sitting.
Wow. I'm looking forward to it.
I'm sure. Start with the pen here. Just tell me if it's very painful here, then I'll reduce it.
Not at all.
So, pinpoint bleeding is normal when you're doing this procedure.
Okay.
And the area becomes a little reddish.
Okay. I certainly do feel that pricking thing, but nothing painful
It's
at all.
comfortable.
Yeah, it's comfortable.
If it does pain, it's adjustable, so you just have to let me know.
Yeah.
But the more you bear, the deeper it will go. So, we're just putting the meso solution there. That's it.
Okay, so basically, this derma roller is helping
It's
the
a derma
solution.
pen.
A derma pen.
Yeah,
It
it's
helps
a
the
pen.
solution to penetrate deep into the
Correct.
layers.
So with the multiple needles that are there, we'll have tiny holes.
Okay.
These holes are so tiny and such good needles that they will shut immediately within 6 hours.
Okay.
So the only precaution that I normally tell my patients is do not wash your hair, do not sweat for 24 to 48 hours. Na?
Okay.
नहीं होना. Yeah.
Okay, we don't have to wash our hair for 48 hours?
At least 24 hours.
Okay.
Sweating for 48 hours. नहीं. No gymming.
Okay.
Any burning sensation till now?
Not so far.
So normally when women have hair fall on the two sides, like these two sides, it's related to external factors such as either dieting or weight loss or nutrients are less in the body, iron deficiency, or maybe if you had a change in residence or some stress, emotional stress, even that could cause this type of hair fall. It's very common in women. So women are always stressed, women are always busy and always nutritionally deprived. So that's always there on these two sides.
Okay.
And when it comes to hair fall over here in the center, you know some women have very big center here.
Partition, yeah.
Yeah. So that is usually because of some hormonal imbalance.
Okay.
We just want to make sure that the solution is gone in. And remember not to take a head wash like for 24 hours.
Perfect.
And no gymming for at least 48 hours.
No gymming so that I don't sweat.
Correct.
Okay.
I don't want you to sweat. And don't use any hair products and all.
Right.
Because the tiny needle holes, they need to shut.
Okay.
And you should be fine. I don't think you'll have any pain. If you do have pain, just take a Crocin.
Okay.
It should be fine. But most of the patients don't need anything. The slight burning sensation is normal for the next 15-20 minutes.
Okay, next 15-20 minutes only.
आप आइस लगा सकते हो if you feel too much.
Right.
Feeling fine?
Absolutely.
Done.
Guys, you saw getting me the mesotherapy procedure done.
And
with
42
doctor.
needles and still nothing.
And yes, I'm absolutely fine, fit and all hale and hearty, and I don't see any pain right now. And so what are you waiting for? If you're facing the same issues, go ahead and get your procedure done. This is it for this video. Hope you enjoyed watching it, and if you did, do not forget to subscribe to my channel and follow my Instagram handle to see how this therapy worked for me. And bye for now.